UI Health. So, welcome again, Dr. Daphne.
Thank you, Ms. Smith.
Yes. Welcome. So, can you tell us a little bit about what it means to be a certified diabetes educator?
Sure. I just wanted to briefly talk about my passion. When I was a student at the University of Illinois Chicago College of Pharmacy, I had a rotation at the old Miles Square location on Washington. And I was exposed to a preceptor who was studying to become a certified diabetes educator. And I didn't know that a pharmacist could do that because I'm a doctor of pharmacy. And so he inspired me to consider a pharmacy residency. So that is a 1 to 2 year experience to continue education, but you're going to be seeing patients and having research opportunities. And I thought, wow, I hadn't considered that. I worked at retail pharmacy during my time as a pharmacy student. And so he really encouraged me. And so I thought, I'm really interested in diabetes. This is my passion. And so I became a certified diabetes educator. They've changed our title a few years ago. So we're certified diabetes care and education specialist. So that's a very long term, but it means the same thing.
Right.
But we have the opportunity to work with persons with diabetes. And I always like to emphasize that instead of calling people diabetic. We were, as educators, taught that the person is not the disease.
Right.
They're a person with diabetes. And I always try to have a very positive approach to my work with patients.
And so I'm curious, was there one thing that inspired you to want to have a career in pharmacy?
Yes, I have an aunt who is a pharmacist. I have several family members who are nurses, and I've always been interested in the health professions. I liked chemistry and biology. Once I got to pharmacy school, I'm like, wow, this is more difficult chemistry than I expected, but I really liked learning about how medications work in the body, but just knowing how a pharmacist can do more than just dispensing medication in a pharmacy. It's very important, the role that community pharmacists have, but I just like to always share that that's not all that we can do. We, of course, are in the hospital setting, but I work in ambulatory care, so that means a clinic setting. So I have the fortunate opportunity to have what is a clinical care protocol. So something that's approved by the UI Health Medical Center that allows me to see patients one-to-one from a referral from their provider. And so I'm able to adjust medications, I'm able to provide education. So I'm a co-manager of diabetes. So I think it's a great opportunity for anyone who is interested in pharmacy, but diabetes education is a big part of helping to manage diabetes.
And I think that's why we really wanted this episode to be something that may not be discussed as often as it should be, and that is diabetes. So can you just explain for all of our viewers, what does that really mean? We hear things in the community, and we know who you are. You hear the sugar. You hear that term being thrown around all the time, but let's talk nitty gritty. What is diabetes?
So diabetes means there's too much sugar in the blood.
Okay.
So when I work with patients, I ask them, what do you know about diabetes? So when I say the word diabetes, what comes to your mind? So it's always a negative thing. They hear about complications. Oh, you could go blind, you could lose your leg or your toe, or you might be on dialysis. And I want to change the narrative. It doesn't have to happen. And so even if you have a diagnosis of diabetes, it can be managed. So there are things that we can do. Lifestyle. So I'm a pharmacist, so of course I know about medications, but I think about a holistic approach, and wellness is very important. So healthy eating. So people might think, oh, I can't ever have a piece of cake, or I can't ever have a piece of pie. The difference is you don't want to eat the whole cake or the whole pie. You want to have a portion, and you want to think about what else are you eating, and you want to think about what is your blood sugar or blood glucose at that moment. So portions matter. So knowing carbohydrates, the types of foods that turn into sugar, knowing that non-starchy leafy vegetables, we want more of those. For most people, they're able to do that. There's some exceptions with certain medications where we have to limit the amount of vitamin K intake. But for most people, if you look at a plate, at least half your plate, leafy vegetables. A fourth of your plate, starchy carbohydrates or fruit. The other fourth of the plate, lean protein. So we think not just sugar, we think about blood pressure and we think about cholesterol. So those are things we have to consider. But the other thing with lifestyle, exercise. So I tell people, you don't have to go to a gym. Whatever activity that you're able to do,
Right.
let's do more of it.
Yes,
So the American Diabetes Association recommends 150 minutes per week of moderate intensity exercise. So that means your heart rate is going up, at least 50% or so. But if we could break that up to maybe 5 days a week, 30 minutes. So we don't want someone doing 150 minutes on one day and they're done
Right.
for the week.
Right.
Right.
So the American Diabetes Association recommends no more than 2 consecutive days without activity. So it's trying to get someone in the habit of being active. So let's say a person hears that 150-minute time period, they're like, that's a lot. Let's start with 5 minutes, 10 minutes. Let's try to do that consistently and then build from there.
Right. And it can be something as simple as walk around the block.
Right.
Absolutely. And I tell people, think about your day, your daily routine and your activity. So there are things that you might be doing that you didn't realize it was physical activity.
Right.
So climbing stairs, but there are people who, might be watching, they say, well, I can't walk or I can't, climb stairs or have difficulty breathing. I can't do a lot of activity. Even working in a chair, doing activity in a chair, whatever arm movements you can do, we just want to encourage some activity, whatever you can do. So no more than 30 minutes, ideally sitting down without being active. So it's hard to do sometimes, particularly when we're watching great programs back to back, but we want to just encourage physical activity.
So it's really sort of like a healthy and whole approach. It's not
Yes.
self-denial. It's not army training. It's just a balanced life.
Right. And I try to have a practical approach.
Right.
So what might work for you might not work for you.
Correct.
And so I think it's important to individualize recommendations because people sometimes get discouraged because they think, well, I can't do that. So let's talk about what you can do.
That's right. That's right.
What about beverage? So water, pop, as we say in Chicago, not soda, fruit juice, coffee, tea, and alcohol, things like that. So what are your recommendations about that?
So water is our primary beverage. So we always encourage that. Sometimes people don't like the taste of water. They could have flavored water or add lemon to their water, or we have products that have a fruit taste to them. But the pop, regular soda pop, has a lot of sugar. So what I do is I show nutrition labels. So I have people, I even teach my pharmacy students about nutrition. So I have like an example of Mountain Dew, or I should say some similar beverage to that. But it contains 77 grams of carbohydrate, and all of the carbohydrates are from sugar. So what does that mean? 1 carbohydrate serving is 15 grams. So we're talking 5 carbohydrate servings in a 20-ounce beverage of regular pop.
Wow.
So that is eye-opening because if you think that's really more than what some people should have at a meal as far as the carbohydrates, but just the beverage, that's not anything else. That's going to bring the sugar levels higher. And so we have people where we tell them a small amount, like 4 ounces of fruit juice. It doesn't have to be orange juice, but fruit juice or regular pop. Just a small amount will elevate or bring up, raise the blood sugar if the blood sugar is low. So we don't want the blood sugar to be too low or too high. So having people understand that what they drink. So coffee is fine, but it's what you put in the coffee. So if you put 10 creams in there or several regular sugars, then that changes the coffee.
Okay.
Right.
So having things that might not have as much sugar content, I'm not going to say, oh, everyone needs to drink sugar-free pop. That is not necessarily the case for everyone. Fruit is healthy, but fruit juice has a lot of sugar.
Right.
So it's, if a person was able to eat a whole piece of fruit, that would be good because it might have fiber in it compared to fruit juice, which will elevate or bring up the blood sugar right away.
Okay, I would love to just get into the detail more of how does diabetes actually affect the body?
Sure. Okay, so I mentioned how diabetes means that you have too much sugar in the blood. So let me talk about what normally happens in the body. So when we eat, our food is digested. Let's say I eat an apple. That apple's digested and the sugar from the food is going to go into the blood. And so normally we would have insulin that's made in the pancreas. One of insulin's main jobs is to bring the sugar that's in our blood into the cells where it's used for energy. So I talk about insulin like a key to unlock the door of the cell to bring the sugar in. So we have to have some sugar in the blood, but not too much, not too little.
Okay.
So what happens with diabetes, there are 2 main types of diabetes. Type 1 diabetes is where a person's pancreas is making very little or barely any insulin at all. So they have to have insulin replaced into the body. So the way I talk to my patients about diabetes is that we all have to have insulin in order to survive. So a lot of times there's a stigma about insulin. So if we let people know this is something that our body needs, I think that's the first step. For type 2, I always try to describe it as 2 issues. So your pancreas might not be making the same amount of insulin like it used to, but one of the main things is what we call insulin resistance. Your body isn't using insulin the right way. So think about a key that doesn't fit into the lock. What good is the key?
Right.
So you might have insulin, but if your body can't use it properly, then your blood sugar will be too high.
That makes sense.
So you mentioned about complications. I just want to state that gestational diabetes, that's having high blood sugar during a pregnancy, which puts the woman at risk for type 2 diabetes later on. And then we have secondary diabetes. So someone might be taking a medication like a steroid or a medication, immunosuppressant that they needed to take, let's say, for a transplant. That could increase their blood sugar. So it's not the traditional type 1 and type 2. It's secondary to a medicine or secondary to another condition. So it doesn't fall into the typical box of type 1 and type 2. So I just wanted to mention that.
Interesting.
But complications. So when I ask people, what do you know about diabetes, they think about the complications. So unfortunately, chronic kidney disease or end-stage renal disease, if we don't manage chronic kidney disease where a person might be on dialysis, diabetes is one of the leading causes of that. Blindness, diabetes that's not well managed could lead to vision impairment. Heart disease, unfortunately, cardiovascular disease is the number 1 reason why a person with diabetes unfortunately passes away. Nerve issues, so neuropathy. So that could be the tingling or numbness in your fingers or toes, but our nerves are very responsible for how we digest our food, how our bladder works, sexual dysfunction. Your quality of life could be affected by your nerves. So those are just some of the types of complications that can happen. Peripheral vascular disease, so when we see amputations or issues with blood flow to the limbs, that could be a result from peripheral vascular disease. So my thing is, those complications don't have to happen. If a person is diagnosed and they start having the complications already, we work very hard to make sure it doesn't progress or get worse.
Okay.
Are there symptoms that somebody can experience to say, boy, I really better get tested, or what would those be?
So, symptoms of high blood sugar or hyperglycemia or feeling very thirsty. A person might drink beverages and they don't seem to be satisfied. They're constantly thirsty, frequent urination. They're going to the bathroom all the time. It seems like almost every hour, maybe even more frequently than that. We do know people can be very tired. I mention to my patients a lot of times, think about a lot of sugar in the blood. It's going to be weighed down. The circulation is going to be a lot slower. So it's hard for the circulation to be what it needs to be. So feeling very tired. A lot of people also feel very hungry. So they might notice changes in their vision. They might have a sore or a cut. It takes a long time for it to heal. So those are some common signs of high blood sugar. And on the opposite end, low blood sugar, a person can feel shaky, sweaty, dizzy, nervous, their heart's beating really fast. They might be confused, they might have a headache, they might be irritable. If we don't eat for a long time, we might not feel that good. Our blood sugar
Get
might be
hangry,
low.
right?
Right.
But you can
Right.
also feel very tired. You could also have blurred vision. So that's why it's important, Adam, for someone to be screened, because they could have certain symptoms that could be high or low sugar, but if they don't get their blood sugar checked or have an A1C, that's a hemoglobin A1C, where it tells us an average of the blood sugar over the past 3 months. That's one way to know if you're that number A1C, if it's 6.5% or higher. A fasting blood sugar, so that's no food for at least 8 hours. If that fasting glucose number is 126 or greater, or if there's an oral glucose tolerance test, there's a sugary liquid. So pregnant women would have that test to determine if they have gestational diabetes, but another person could receive that test. But if that glucose measurement is 200 milligrams per deciliter or higher, or random, so if someone stuck your finger and that sugar number is 200 or greater, that would be diabetes. But we like to confirm it with another test. So we say, yes, this person has high sugar, but we like to confirm the test if possible.
How elaborate or complicated is the testing process as a patient? So if I want to get tested, is it just part of my regular physical with my primary care physician? How complicated, easy, whatever is it to get that done?
So it can be as simple as a finger stick. So whether it's a glucose level or an A1C, like for instance, in our clinic at Miles Square Health Center, which is part of the University of Illinois Chicago Health System, UI Health, we have a machine that allows us to get the reading in 5 to 6 minutes. So the person within their visit with their healthcare provider could find out right then. So finger stick, but we could do a blood draw if necessary as part of their general labs to also get their glucose checked and their A1C checked.
Do you find that there are certain communities that tend to test higher for having diabetes?
Yes, so more than 38 million Americans have diabetes. Unfortunately, 8.7 million of that number they estimate don't know. And so in Illinois, more than 1 million persons have diabetes. The overall national average is about a little bit more than 11%, but in the Chicagoland area, it's about close to that amount too. It's more than 10%. But this is the concern. The population that we serve near here, UI Health, is between 20 to 37%.
Wow.
We do know that Black and African American patients, as well as Hispanic and Latinx patients, are more likely. Actually, Native American population has the highest incidence. So it's very prevalent in certain communities, but I always tell patients to ask their family members if possible.
Right.
Family history is a risk factor. Age is a risk factor. So we used to look at people at age 45. Now it's 35 where we're starting to randomly screen. But if someone has a higher BMI, so body mass index, if they're in a high risk ethnicity group, if they have high blood pressure, if they have pre-diabetes, so that's where your blood sugar is a little bit higher than the normal range, but not yet at the diabetes. So 100 to 125 milligrams per deciliter, for instance, for fasting. So if someone has what we call dyslipidemia, so high triglycerides, low HDL, which is the good cholesterol. So there are several risk factors. I just pointed out now HIV is a risk factor for diabetes. So there are a lot of risk factors, but what you can do to get more information, the American Diabetes Association, so www.diabetes.org. If you are interested in the Diabetes Wellness Education Program at UI Health, that's 312-413-3631. Miles Square Health Center right down the street, 312-996-2000. So just some numbers in case you would like to have more information. But on the web, there's a wealth of information, and the American Diabetes Association has a lot of information that will be helpful.
So great.
And can you repeat, just in case people weren't writing it down, what's the website?
www.diabetes.org.
Okay, well, that's an easy one to remember.
Yes.
It
Good,
is.
good.
If you had to tell people in a few sentences, what are the most important things that you want people to understand about diabetes?
It can be prevented. If you do have diabetes, it could be well managed. And having a diabetes educator on the team will be very helpful. But if you don't have a diabetes educator that's part of your healthcare team, at least see your primary care provider. At least try to have a provider that you see regularly.
That's so important, I tell you. Adam, did you have any other questions?
I think that's great. You know, this has been a wonderful education, and I really appreciate your, I know Dionne does too, you're joining us and you're providing all this insight, because I learned a lot today, I have to say.
Well, I think what's important also, since we do have a few more minutes left, I think what's important too is everything that Dr. Smith-Marsh talked about hopefully will help you prevent diabetes, because we know that diabetes may lead to other diagnoses. And the work that we do at the guest house, which is provide temporary lodging when you need to stay close to the hospital, hopefully if you can tackle some of those pieces, you may not need to see us. We honestly are here to help you. We're here. We're a wonderful, valuable resource in the community, but we don't want to have to see you.
Right.
We really don't. We want you to be healthy, but we're here as a wonderful resource if you need it. So hopefully you will pay attention to some of the things that she just mentioned. So if you want to help us at any time, please visit our website, which is www.guesthousechicago.org, and you can call our main number, 312-996-1167, and someone would be happy to answer any questions for you. Now, one thing I will say is, if you want to help us actually stay in existence, we have a golf outing that's coming up next month on Thursday, September 12th. So we hope that you will actually think about the golfers in your world. We want to invite you to come out. We hope that you will spread the word, because it's a wonderful way to celebrate our 25th anniversary year. And remember, all the golfers in your world need to come and support our golf outing.
Right.
So please join us.
Right. When we do these events, we have a lot of fun. We meet some great people. You get to meet Dionne, you get to meet me. But beyond that, it helps us deliver our mission and be sure that we never turn anybody away for financial reasons, and we can always support guests who need our help. The other thing that I take away from this discussion doctor is how important it is to be willing to get treated, or tested, I mean. That's the first thing is, it doesn't help you to say, well, I don't have diabetes because I haven't been diagnosed with it. Like, it's more important to know and to see your doctor on a regular basis and take care of those things, because if you don't know, you can't help yourself. And that's when people have problems.
That's very true.
So we hope you'll join us next month for Guest House Sweet Home for Patients and Families in Chicago.
Thanks so much.